All right, thank you for attending today's training on ImmuNet Part 2 webinar training. I am Elise Booker-Reagan, health educator for Maryland Center for Immunization. We're going to get started in just one moment. If you are on the line and you are participating by phone or a handset and you have a question, please click on the hand icon and we will unmute your line so you can ask that question. But if you don't want to have your line unmuted and you want to type a question into the chat box, please feel free to do so. Also, if you're participating by speakers on your computer and you have a question, please type in a question into the chat box. We'll read it out loud and do our best to answer it. Without further ado, I'm going to bring Jason Linker to the phone to go ahead and begin our webinar training part 2.
Good afternoon. My name is Jason Linker. I am the Assistant Immunization Registry Coordinator for Maryland. And today we will be discussing the ImmuNet webinar training part 2. Our learning objectives for today are editing your VFC profile in ImmuNet, submitting a VFC inventory report through ImmuNet, ordering specialty and flu vaccines through ImmuNet, and adding, modifying, and inactivating ImmuNet inventory. ImmuNet is a secure online database that holds vaccine histories for children and adults throughout Maryland. ImmuNet data is confidential and fully HIPAA compliant. ImmuNet is easy to use. For purposes of reporting administered vaccines, ImmuNet can often get this data automatically from electronic health records in your office. And as you'll see today, ordering your vaccines from VFC through ImmuNet is also going to be much easier in the coming year. As a reminder, in 2017, VFC providers will be required to report VFC vaccines administered to their patients. That is new vaccines administered in 2017, not VFC vaccines previously administered in other years, nor is it required for you to report your privately purchased vaccines administered. And VFC providers will be required to order their vaccines, including specialty and flu vaccines, through ImmuNet. We will, at some point next year, stop accepting the paper form that has been faxed these past years. As I said, reporting to ImmuNet is mandated for all enrolled VFC providers starting in 2017. And setting up electronic data exchange between your electronic health records in your office and ImmuNet will allow you to meet this reporting requirement without any interruption in your workflow. And today's topic, in 2017, you will be ordering your vaccines through ImmuNet. This will, we believe, be much easier and faster than faxing in inventory forms. And for the first time in Maryland VFC history, you'll be able to check the status of your vaccine order and track the package. Next year, ImmuNet will have an enhanced user experience with simplified menus and workflow. Today, you'll see what that will look like. If you'd like any additional training on topics covered using how ImmuNet currently looks, please view the training videos available at mdimmunet.org. Click on HT3, Hot Topic 3, near the top center of the page. Although a training video is available for ImmuNet inventory management, there are not VFC vaccine ordering videos at this time. As always with ImmuNet, you should start at www.mdimmunet.org. On this page, you will enter your username and password. If you've forgotten your password, you can click Forgot Password next to the Login button. If you don't remember your username, or you have never set up the security questions for the Forgot Password functionality, you will need to contact your office's administrative user or the ImmuNet Help Desk. As a reminder, each individual using ImmuNet should have their own username and password. Usernames and passwords should not be shared between multiple users. Once you've logged in, you'll be directed to the new ImmuNet front page. To easily access your VFC information, click on VFC Inventory and Orders. It's circled in red on this screenshot. That brings you directly to your VFC profile. On this page, you can edit your VFC profile, generate a VFC inventory report, order flu or specialty vaccines, and check the status of your order. We'll go over each of these functionalities individually. To edit your VFC profile, click Edit VFC Profile, circled in red on the screenshot. From this page, you can confirm and edit your primary and backup VFC contact information. Be sure to also confirm that the delivery times are correct. The delivery times are available in 2 different windows to account for a daily lunch hour in which you cannot accept deliveries, or any other break in the middle of the day. For example, if you were closed from noon to 1 on Mondays, in the Monday delivery window 1, you would put in your opening time until 12 o'clock, and in delivery window 2 for Monday, you would put 1 o'clock until closing time. In the section below what's visible in the screenshot, there is a section for additional medical providers. After editing any information on the screen, click Save to save it into your profile. In the following slides, we'll show you how to order your vaccines through ImmuNet. Please be aware this functionality is not yet available to you, but VFC will send communication to providers when it is. Please be sure to be checking your email regularly for updates from the VFC program. Remember also that ordering your VFC vaccines through ImmuNet will be required in 2017. These following slides are vitally important. To generate a VFC inventory report, click the Enter Inventory button, circled in red on the screenshot. As with the fax forms, you should do this when you're getting low on vaccine, not completely out. Doing so brings you to the Provider Inventory Data screen. Add the quantity and doses for each lot you have in your VFC inventory. If you don't have any inventory on hand for a particular lot, put in a 0, as all rows must be filled. So let's look at this part in more detail. As you can see, lines 2 and 3 are active with 2 different lot numbers. If you had 10 doses of Actib lot number 999999, you would put a 10 in the quantity and doses section for that row. If for lot number UAT checkout you had 0 doses left in inventory, you would put a 0 in that row. Do the same for each row. The Provider Inventory Data screen will show lots which are active and non-expired in your ImmuNet inventory module. That means that it will generally only show the vaccines that you have been sent by VFC, not vaccines which are not your vaccine preferences. When you've completed all rows, click Submit Inventory. If you don't see a lot number you have on hand on the VFC inventory report, press Cancel and enter the vaccines into your ImmuNet inventory. I'll show you how to do that a little bit later in today's webinar. That should be very rare, but it may happen. Remember that just like the paper form, the VFC inventory report should be filled with doses on hand. For multi-dose vials, you should report the number of doses left in the vial, not the number of vials. Remember to match the lot number for the vaccines on hand with the lot numbers on the VFC inventory report. Be sure that you are accurate. The VFC inventory report determines how much vaccine you are sent. Inaccurate accounting on the VFC inventory report may result in you being sent too few vaccines or too many. The VFC inventory report on ImmuNet will never show expired vaccines. For expired vaccines, you must continue to use the paper vaccine return form. and fax that to the VFC Contact Center. TD, DT, Pneumovax 23, and the Men-B vaccines are considered specialty vaccines and are available through the specialty vaccine ordering page, which we will cover now. To order flu vaccine or specialty vaccines, click Order Specialty/Flu Vaccines. The flu part of that will only show up when flu vaccines are available for order. When it's not flu season or flu vaccines are otherwise not available, it will only say Order Specialty Vaccines. Ordering specialty and flu vaccines, just like it is now, is a little bit different from ordering your normal vaccines. For specialty or flu vaccines, you should put in your current inventory for each flu or specialty vaccine in the inventory entry section at the top. This section will only show flu vaccines or specialty vaccines which are available. On this, you should combine the total number of doses for all lots of a given vaccine that you have. In the section below, put the amount that you would like to be sent. If you would not like any of a particular vaccine type, put a 0 in the order quantity. Otherwise, order quantity should be in multiples of 10. Under this section is a justification section where you will be asked to justify your request. An example of justification might be a flu vaccine clinic coming up in your office, or a number of patients which require a specialty vaccine, and the reason that they need that vaccine. When you're done, click Confirm Order. As I mentioned before, you'll now be able to track your VFC orders. You can do so from the VFC profile. Your order can have several different statuses. Immediately after you have completed a VFC inventory report, the order status will be pending. That means it's been submitted, but it has not yet been approved by the VFC program. At this time, you can still edit it by clicking on Pending, which you may wish to do if between the time that you completed the order and whatever time you're looking at it later, a number of vaccines have been used, which make you want to change the number that you have on hand for this report. Clicking on Pending will take you back to the Submit Inventory Report screen. After pending comes In Progress or Sent to Distributor. That means that your inventory was submitted and has been approved by the VFC program. Your order will first change to In Progress and usually later that same day, Sent to Distributor. At this time, your order can no longer be edited. However, you may click on the Report ID link to see the inventory report that was sent. Finally, your vaccine order status will change to Shipped/Complete. That means the order has been sent to your office from the distributor. Clicking on the Report ID will still allow you to see the inventory that was submitted. But now clicking on the Shipped/Complete link will allow you to see what was sent and find the carrier and tracking number. Sometimes the order status will be partially shipped. That means that part of the vaccine shipment was sent, but not the complete shipment. This may happen sometimes because the distributor is low on vaccine, or because they sent out a direct ship frozen vaccine before they sent out the rest of your order. The status will change to Shipped/Complete when it's done. Clicking on shipped/complete brings you to the order tracking page. This is a list of order line items, each of which is a vaccine. In this case, we're looking at order line items 12 and 13. As you can see in the red circles, there is the trade name and description of the vaccine. Order line item 12 is Rotarix in a 1-dose vial. Order line item 13 is Varivax in a 1-dose vial. The blue circles for each order line item contain the quantity shipped in doses. 10 doses of Rotarix were sent. 20 doses of Varivax were sent. The green circles show the carrier and tracking number. Order line item 12 was shipped by FedEx. FDX2 or 1 is FedEx. That tracking number can be tracked at FedEx.com. The Varivax was shipped by United Parcel Service, UPS. That tracking number can be tracked at UPS.com. This shipment was sent on 2 different carriers because the Varivax is a frozen vaccine and was sent ahead of the other order. Line items 1 through 11 were all sent along with order line item 12 on the same carrier with the same tracking number. Should you click on an order's report ID, it brings up the inventory report for that order. Here you will see each lot and the quantity and doses that you declared in your inventory report. As you can see in this case, the quantity and doses for all vaccines was 0. This should never be the inventory report that you sent, as you should always submit an inventory report when your vaccine inventory is low, not completely gone. We'll finish up today by talking about the ImmuNet inventory module. The inventory module is available to users right now to look at the ImmuNet inventory. The inventory module allows you to track the number of vaccines you have on hand easily. It can show you what will be expiring soon and quantities that are low, helping you to better time your vaccine orders. Click on Inventory to go to the Manage Inventory page. On this page, you'll see active inventory that is going to expire and inventory that is running low. Please note that it shows inventory that is running low by vaccine group and by trade name. To show the complete ImmuNet inventory for your office, click Show Inventory. From here, you can see the specific vaccines you have on hand, their lot numbers and quantity. You can add inventory or modify a quantity of existing inventory from this page. As I mentioned before, in some rare cases, ImmuNet may not have the lot numbers that were sent to your office of a vaccine. That happens only very rarely, but when it does, you'll need to add it to your ImmuNet inventory by coming to this page and clicking Add Inventory. On the Add Vaccine Inventory Information screen, select the trade name first from the top drop-down. The manufacturer will be automatically added, as well as the NDC if only one exists. If there's more than one NDC available for that vaccine, use the NDC drop-down to select the correct NDC. Then add the lot number, expiration date, and quantity on hand. Again, this will be done automatically for most, if not all, vaccines sent by VFC. This will be very rarely needed. When you're done, click Save. If you'd like to use the ImmuNet inventory module to track your privately purchased vaccines, when you add them, which you will have to do manually, make sure you switch the funding type from public to private. The public funding type should only be used for your VFC vaccines, as that's what ImmuNet uses to determine what should be on your VFC vaccine inventory form. If you're tracking your ImmuNet inventory, if you're tracking your on-hand inventory through ImmuNet, you may need to occasionally modify the number of doses you have on hand. To do so, click the checkbox next to the trade name and lot number for the vaccine you'd like to modify, and then click Modify Quantity. Select whether you're going to add or subtract from your inventory. Select the amount that you will add or subtract, and then give a reason. When you're done, click Save. Vaccines sent from the VFC program are automatically entered into your ImmuNet inventory module. VFC has been doing this since about mid-2013, or whenever you first enrolled, if that's later. Your active inventory in ImmuNet may show lots that you've already used. An active and unexpired lot will show up on your ImmuNet inventory report. To remove them from your VFC inventory report so that you no longer see them and have to put a 0 for that row, click the trade name for the lot you'd like to inactivate. On the Edit Vaccine Inventory Information screen, change the Lot Active indicator to No, and then click Save. If the Delete button appears, please do not click Delete. This can affect your patient records. You should always remove a lot from your VFC inventory report by changing the Lot Active indicator to No.